Okay, just want to thank you for taking the time today to talk to me, Michelle. I'm just here to talk to you about communication methods in the workplace, and I was just going to ask you what your profession is in the health environment and what roles you must undertake in this profession.
Okay, I'm the supervisor at front desk in a radiology department in a private hospital. So we see a lot of people throughout the day, patients between 150 and 250 a day. So that's just the patients. Then I have about 7-8 people to look after, and that can cause friction at times.
That must be very difficult to handle, I can imagine.
It is sometimes.
Yes.
It is, yes, very stressful sometimes. Yes.
Okay, so in this sort of environment, why do you think communication is important? And if you do think communication is important, can you just explain why you think that is?
Okay, I think communication is the most important thing in any profession, really, because you're dealing with customers. In our case, it's patients. So in our case, in a hospital environment, they're mainly sick people, some of them very, very, very sick. So they're at their worst time of their life, most likely as patients, but also they have family members with them, so they're always very emotional.
Yeah.
Not well, so that obviously makes them feel even worse than they would. So they react probably differently to a healthy person would in a lot of circumstances. So we have to take that into consideration when we deal with them.
I can imagine that be a bit responsible, kind of make you
It
feel
sometimes
a bit,
is very, very hard, because sometimes people are extremely obnoxious and grumpy, rude, very rude at times, and you know, you have to have a certain amount of compassion, because you know, we know that they're not well and sick. So that makes it sometimes easier for us, because we have a reason to rationalize the rudeness away, so to speak. But yes, it can get quite stressful at times, because it's not just dealing with the patients, but it's also the workload that we have to deal with on top of everything else, and we can't hurry things along, and we can't really hurry the patients along if they feel like talking, and especially if they're upset, you have to take the time to actually deal with them at that moment. And it makes it hard if you have the workload as well to cope with, and you have deadlines every day, and you have to, you know, finish certain things. So that can be extremely stressful sometimes.
I can imagine, because I mean, I work as a retail kind of assistant in a shoe shop, and I don't really have the amount of pressure that you have to deal with. I don't know if I could deal with that myself, but I mean, I do get difficult customers at times. So if you did experience a difficult patient in the workplace environment, how do you think you would take action to sort of ensure that problem would be resolved?
Well, first of all, you listen. That's the most important thing. You just listen and let them finish and let them say their piece, and then you try and help to resolve their problems. That's probably the most important thing, I'd say. And sometimes they can't be resolved, but I think people in general, when they can actually feel that you're trying to help them, it's okay, even though the problem not necessarily can be resolved, but they know that you've done your best. That sometimes is already good enough for them.
Yeah. Can you give me an example of a time that a patient has been difficult to deal with?
We get quite a few patients when they're really, really sick, and they have a lot of scans, very, very expensive scans, and they have huge hospital bills on top of that, and then they sometimes go to the emergency department, which is also a separate cost. So cost comes up a lot, and when they are feeling really unwell and they're not sick, and you know, it's hard sometimes, but you know, it's a business. And the outstanding invoices have to be, you know, met by them. So that often causes a lot of frictions, and sometimes we actually have to get management to talk with some of these customers, because they will not understand why they would have to pay their bills when they clearly have to. Yes.
Also, so I assume that there's a lot of difficulty in the workplace environment with the patients that are undergoing severe, you know, disorder and all of that kind of thing, with their payments and all that. But I assume that you would build good relationships with these patients as well in some circumstances. So communication's quite good in something.
We get a lot of positive feedback. We also got a feedback forms, of course, that they are welcome to fill out at any time, whether that's positive or negative, and we always look at